So in my clinical work, I often meet families who believe that we share more information than we do between, say, health organisations. And at this moment in time, that is categorically not true. Very little information is shared unless it's by letter or unless there is a safeguarding issue, for instance. So the frustration with that for patients and families is that they will basically be asked the same questions time and time and time again. Even within the same service, they'll be asked it many times, but between services, so a referral has gone from one professional to another professional, it's not unrealistic for that family or that person to believe that enough information has been handed over. But if the referral form contains 5 lines of information, very little information has been handed over, and either information that is important is lost because it's not asked another time that could be highly relevant to the current situation, or people can become very frustrated that every time they meet a new professional they spend an hour repeating themselves, and if what they're talking about, for instance, is traumatic, that isn't going to help with an individual developing trust in professionals, but also developing relationships that are around feeling safe around their information. The Great North Care Record is a system that brings people together. It brings hospitals together, such as mental health, physical health. It brings ambulance services, GPs, and hopefully wider than that, including social care, to make sure that patient care is timely, it's accurate, and it's safe. So the use of data for population health is really important. It allows services to be commissioned that meet the needs of a local population. So if in one area you had lots of children and in another area you had a lot of individuals who were older, your services would need to be different. But if every area had exactly the same service, it wouldn't work for all the areas. So it's really important that we can share health information for the purposes of research and population statistics to better meet the needs of the population. So data sharing would be really important to my patients, particularly if there's a crisis. It would allow an ambulance service, a general practitioner, a mental health crisis service to all work together to understand exactly what is required. And that information would also be available in A&E. So if, for instance, one of my patients appeared in A&E in crisis, it would allow care plans to be reviewed and crisis plans. That would allow services to make a decision about the most appropriate way forward at that moment in time, perhaps give some tips and tricks, or to check whether support and advice was appropriately in place. Without that, the wheel gets reinvented time and time again with the same mistakes made or not meeting a person's needs. So for instance, an individual may present as being suicidal, and they may have presented 30 times in the last 30 days as being suicidal. Now, it's clear that an action plan and a care plan are required. One, to help the individual manage their thoughts, and secondly, to help services understand what they can offer that is best. And those plans need to be available at the points of care. Otherwise, each individual doctor or nurse or ambulance crew that meets this individual may choose the same options or options that have been found to be really unhelpful in the past. So this is all about safe care at the right time, in the right place, that is timely and meets the needs of that individual. And in an ideal world, these will be shared care plans that the person themselves has had active involvement in designing to meet their own needs, rather than being told what to do.